Hello, welcome to the live class on pregnancy diagnosis in domestic farm and pet animals, right? And we discuss about how pregnancy diagnosis is being done, what are the methods, and what are the advantages or disadvantages of each of the methods, right? Now, the very first thing is what is the concept, why pregnancy diagnosis should be done, and the first concept is confirmation and evaluation of the success of the artificial insemination. You got your cow inseminated and you do not know it if it has not returned to estrus. You do not know whether the cow has become pregnant or not, and then identifying and treating non-pregnant animals, that is much more important. If your cow is pregnant and at pregnancy diagnosis you found it pregnant, there is nothing much to explore. But if the cow is non-pregnant, it should be treated at the right time. Friends, follow my GNP Sir YouTube channel and you will find a lot of other materials. If you have not subscribed, kindly do subscribe to it. If you have already subscribed, I am highly thankful to you all. So, we discussed this is the concept why pregnancy diagnosis is being done. Then, the sale of the animal, say somebody wants to sell his animal, and a person who is purchasing the animal, he will, and the owner says the animal is 3 months pregnant or 4 months pregnant, then he will call the vet for a pregnancy diagnosis to confirm uh, the pregnancy status before sale. Then monitor the development of the pregnancy, confirm the absence of the twins, monitor early embryonic deaths. This is especially possible if you have ultrasound available with you. Then improve the record keeping. You as soon as the animal is confirmed pregnant, you mark it in the record. So many days pregnant on this and this date. Then informed decision on individual cows, improve the management, improve the feeding. These are the basic reasons why pregnancy diagnosis is being done in cattle and buffalo. Now, the what is the goal or of any method used to perform the pregnancy evaluation is to determine the pregnancy status with 100% accuracy. Determine the pregnancy as early as possible. Judge the age of the conceptors, determine the viability of the conceptors, and possibly determine the sex of the fetus and have the results immediately. So these are the goal of the method that you will use for pregnancy diagnosis. Now, the pregnancy diagnosis methods have been classified as the direct or the indirect methods, and then the it has also been classified as the management of the visual methods, the clinical methods, and the laboratory tests. So each one is mentioned here. Non-return to estrus is the first method, and then clinical methods include transrectal palpation, transrectal ultrasonography, radiography, and fetal ballotment. And laboratory tests include many of the laboratory tests, including the assay of the hormones, the chemical test, and the biological test. Right? Now, non-return to estrus, the farmer first thinks that the cow is pregnant if he got his cow inseminated and if does not return to estrus 18 to 24 days after AI. So, what are the problems with this method? That estrus detection, if the estrus detection efficiency is low, then your results will be affected. And poor estrus behavior of parturient animal, and estrus cycle length varies from 21 to sometimes even 26 or 27 days. And early embryonic deaths after day 15 will prolong the cycle length. So these are the problems with the non-return to estrus. So it is our duty to educate the farmers to get the pregnancy check at 60 to 90 days very positively. Then the Visual method, another visual method is assessing the enlargement of the abdomen, udder and vulva, but this may be misleading. Sometimes a animal is very weak, the abdomen is not at all enlarged, and it might be pregnant. Whereas in other animals, the abdomen is much enlarged because of the distension due to other reasons. Then and you think that the animal is pregnant, and on a palpation you find that the animal is non-pregnant. Then there is one method, that is the cocking of the tail. As you can see in this picture, common in camels and appears 14 to 18 days after fertile mating. So by this method, camel breeders frequently detect the pregnancy. But even though we suggest that a camel with ovarian cyst may show tail cocking, and this could be misleading. And even if at many places around the world, there is a tendency to have a progesterone profile done for camels, and even the camels with ovarian cyst may show a higher progesterone level. So it is necessary that we should go in for pregnancy diagnosis by the manual method, by the transrectal palpation or maybe transrectal ultrasonography. Now, transrectal palpation is one of the oldest methods, and with a bit of proficiency, determining pregnancy by transrectal palpation in cattle requires some experience and a thorough knowledge of the cow's reproductive tract. If, as a clinician, you have palpated a 2 month pregnant uterus and you have felt the resilience, you will never forget it, and you can always diagnose pregnancy at 2 months. So, transrectal palpation continues to be one of the choicest methods around the world for diagnosis of pregnancy, especially at places where, in cattle and buffalo at least, and at places where transrectal ultrasound is not easily available, right? Now, for transrectal palpation, you need a bit of restraint, and you can restrain cows in a chute, or you can tie the legs, both the hind legs. Sometimes, if the cows are docile, one may attempt to do the palpation in the open, but be careful. Always take care for yourself first. For buffaloes, they are restrained by the forelegs and a rope tied over the neck in the field level, because buffaloes usually do not kick with the hind legs. So that is a advantage, and you can palpate the buffaloes. But buffaloes would run away even with the both the forelegs tied. So sometimes a palpator is not able to palpate the buffalo for pregnancy. Then for palpating the mares, it is always advisable to place the mare on one side of a small wall, as you can see here, and palpate, and then tie the both hind legs with one foreleg, apply a twitch, and then do the palpation. Your safety is essential. Camels have to restrained in a sitting position for transrectal palpation. At some places, they are performing transrectal palpation with the camels even in the standing position. But they have built specialized crates, and they administer a bit of xylazine to the camel so it becomes docile and it does not object to your palpation. Right? Then you need a protective clothing. Never palpate any cow, especially mares. You do not palpate without a sleeve, because uh, mare dung has Clostridium tetani. They reside there, and one may contract tetanus. So do not make palpations without a sleeve, at a rubber sleeve or maybe a disposable sleeve, and use sufficient lubrication. Try to use a non-irritant lubricant so that it does not cause harm to the genital mucosa. And with buffaloes, the palpation should be gentle, because the rectal mucosa of the buffalo bleeds very easily, right? Then the procedure, you all know, make a cone of your hand and then introduce your hand inside. You can watch our one of the videos for transrectal palpation method, and then you have to introduce your hand inside. And once you take out the dung inside without taking your arm fully, and because if you take out your hand often on, then air will enter inside the rectum and rectum will be ballooned, and so it will be very difficult to palpate anything. And a cow with a rectum balloon, you can put move your hand up and down without any difficulty. So if the rectum is ballooned with air, grasp the rectal mucosa and uh, move your hand back and forth so that the air inside comes out, right? So that way you can remove the air inside and you can proceed with the palpation. Now you can watch one of our videos. You can see how you can make a cone of your hand with gentle pressure, introduce your hand inside, and then you can just remove the, yeah, as you can see here, we are removing the dung without taking the hand completely out, and then you can watch this video at YouTube on for how to make the palpation and how to grasp the cervix, how to locate. So when the rectum is balloon, catch hold of the rectal mucosa and just pull it back, but do not take your hand out completely. So this will push the air outside, and then the ballooning in the rectum will be out. So when you start palpating the genitalia located on the pelvic floor, and you have to make your hand sliding movement like this, and this will catch hold of the cervix. This is the cervix, this is the heart structure, and you can palpate. So you can watch this video later on, and it's available on YouTube at the JNP Sir channel. Now, there are 4 positive signs of pregnancy in cattle and buffalo. The fetal membrane slip is the first one. You catch hold of the, as you can see in these pictures, a membrane will slip. Then the amniotic vesicle, you can palpate them, the placentomes, the fetus, the fremitus or the middle uterine artery thrilling. So these are some of the positive signs of pregnancy in cattle and buffalo, and you can see here in this picture at around 2 months of pregnancy, one of the uterine horn is much enlarged, and when it is 3 to 4 months and beyond, then uterus will be sufficiently enlarged, and this is the palpation of the middle uterine artery thrilling. You can feel the placentomes, and these are the placentomes. As you can see, one of the uterine horn is enlarged, and you can easily differentiate an enlarged uterus from the non-enlarged. So this is how at 30 days one of the uterus is enlarged. At 72 days you can even feel the fetus, and 4.5 months the uterus is much enlarged and it starts descending into the abdominal cavity. So these are the cotyledons which you can feel beyond the 4 and 5 months, when it is the uterus has gone downside and it is not possible to palpate the uterus or the fetal structures. So, palpating the cotyledons at this time will be the appropriate method to diagnose pregnancy, right? And then in advanced pregnancy, you can see here at 4 to 5 months and beyond, the uterus has gone down, and one can feel the cotyledons and confirm the pregnancy, right? And then later on, you can even feel the fetal parts beyond 7 months. You can feel the fetal parts. So these are the days when you can palpate. These are the days and the palpable findings. The amniotic vesicle, 30 to 65 days. Asymmetry of the uterine horns, 35 to 90 days. fetal membrane slip 35 to 90 days, fetal bump 65 to 150 days, cotyledons, fragmitus, and fetus and its movement. You can feel the movement of the fetus as well. So this is the amniotic vesicle diametrics at different days of gestation, and this is how it is written. It has been mentioned that at 9 centimeter at 2 months, 22 centimeter at 4 months, 44 centimeter at 6 months. So this is the crown rump length of the fetus which you can measure. Now, transrectal palpation in the equine species, mares, donkeys, can be done. As I said earlier, it should be restrained on one side of a wall, and both the hind legs should be tied with one of the foreleg, and you can even lift one of the foreleg and apply a twitch, right? But one should be careful when palpating mares, because mares, even this mare which has been restrained properly, it may kick, and if you are not very careful and you are doing it in the open space without a partition like this one, then this may cause problem to you, because the mare may even kick. Sometimes the mare kicks even when it is restrained, as you can see in this uh, video. This is the way how one should go in for the palpation. Then the uterine tone in the equine species appears as early as day 15 to 16 and continues up to day 48 to 55. The bulge in the uterus appears and progressively increases in size and is palpable in most males by day 30 35, approximately 3 to 4 centimeter in diameter. By day 42 to 45, the conceptus occupies approximately half of the gravid horn and is 5 to 7 centimeter in diameter. The uterine wall over the bulge is thin. At 72 days, the pregnancy is like an elongated football and is nearly similar to a 60-day pregnancy in dairy cattle. Then the uterus is located in the pelvic cavity or just at the pelvic brim until day 90. At 100 to 200 days, the gravid uterus is positioned cranial to the pelvic brim in the abdominal cavity. The position of the ovaries up to 60 days of pregnancy is similar to that of the non-pregnant mare, and the finding of both ovaries nearer to each other and close to the pelvic floor is a positive indication for pregnancy 3 to 5 months. The ovaries will descend lower in the on the pelvic floor, but by 5 months of pregnancy onwards, the ovaries are not palpable as they are under the broad ligaments. So this is how you can do the these are the findings in mares for pregnancy diagnosis by transrectal palpation. In some large size sows, you can do transrectal palpation and at around 21 to 30 days of gestation, the bifurcation of the cornua is less distinct. Parameters can be identified at 37 days. Middle uterine artery is 5 to 8 millimeter in diameter and more easily identified. Uterus becomes progressively thin walled and ill defined by 31 to 60 days, and beyond 60 days, the femtus is very strong. Piglets can only be palpated towards the end of gestation, right? So, this is how you can perform pregnancy diagnosis in pigs. Then in female camels, the persistence of the CL is the earliest sign of pregnancy, as otherwise the luteal phase is very short. Uterine horn is inherently longer. The left uterine horn is inherently longer than the right uterine horn, and there is exclusive left uterine horn pregnancy in the camel. The earliest detection of uterine change, increase in the diameter, and appearance of fluctuation is palpable at around day 40. Between day 60 to 70, left uterine horn is increased about twice to its non-gravid size, has a thin wall, and fluctuates. Right? The uterus is more cranial and ventral after the third month of pregnancy. The cervix is pulled forward and lies at the pelvic brim by 4 months. At 5 months, uterus is completely abdominal and fetus is not palpable. Fetus becomes palpable after 6 months. By the ninth month, the fetal movements can be seen in the right flank. External signs of pregnancy and large abdomen and udder are visible from the 11th month. Precise estimation of fetal age beyond 3 months is not possible in camels. Then the next method is transrectal ultrasonography. I will not be going into the details of transrectal ultrasonography as we have a separate So we have a separate video lecture on this transrectal ultrasonography. Then here are the probe placement. All this we have discussed in another lecture on transrectal ultrasonography. Then radiography is a method of choice for estimation of pregnancy in small ruminants and the dog. Sheep and goat fetuses are visible by day 70 of gestation. Dog fetal skeletons are visible with high accuracy only by the 6th week of pregnancy. Fetal skulls are visible by day 45, and the entire fetal skeleton is visible by the end of 7th week of gestation. So these are the radiographs of the dog showing the pregnancy. Then abdominal ballottement and palpation is possible to some extent in cows during late gestation, 7th month onward, and palpation of the fetus through the abdomen is possible in sheep and goat only beyond 4 months of gestation. In dogs beyond day 55, it is easy to diagnose pregnancy by the palpation of the fetuses. Then there is one method, the recto-abdominal palpation, wherein a rod is placed inside and the fetus is tried to be palpated through the abdomen. This is maybe a traumatic method, so it is not readily suggested. Then there are the laboratory tests. They can be done if the animals are irritable and rectal palpation is not preferred. There is lack of ultrasound. These include the progesterone hormone assay, the specificity of around 98%, progesterone concentrations in milk or serum. Usually, samples are collected at 21 and 24 days after insemination, but the problem is there are many false positive results with this test. Then estrogens from the feto-maternal axis appear in milk, urine, feces, and blood. And there is a Punyakoti test, which wherein wheat seeds soaked in urine do not germinate if urine is from a pregnant cow. Then there are this table. It shows the appearance of estrogen in domestic animals during different stages of pregnancy, and you can read them. Then there is a barium chloride test. Barium chloride solution plus urine in equal parts. In non-pregnant cows, a white precipitate is formed. In pregnant animals, the urine remains clear. The accuracy of this test is not very high. Then there is a Cuboni test, which detects the conjugated urinary estrogens after day 50 of gestation in the equine species, and a green fluorescence appears. Then commercial kits for urinary estrogens in mares include the V-fold checker or Equitest ES. Then there is a Allen-Dozy test wherein injection of pregnant mare's urine to spared mice produces estrus-like signs in the female tract. Then there are other tests which are not very accurate, but they have been described and they may be asked in any of your exam: the milk alcohol coagulation test, the copper sulfate test, and you can go through this PDF, which I will be making available in the app itself. And then the mucin test or the pregnancy cells that appear in the equines. This test is also not very accurate, but may be asked as a part of your examination. Then PSP, phenol sulfonic acid test. It has 70 to 80% accurate when performed between 120 to 250 days of pregnancy. Biological tests like detection of the equine chorionic gonadotrophin, it's secreted from day 40 to 120 days of gestation. And for this, there are three tests: the Asim-Jondak test, the Friedman rabbit test, and the toad test. The basis of this test is the concept that sperm cells are emitted by toads, frogs, only when stimulated with female frogs or gonadotrophins. Then on-farm tests detecting ECG include the Pregnamare. Milk ejection by low-dose prostaglandin has been suggested for cattle and sheep. That if you inject a low dose of prostaglandin, a pregnant animal, there will be letdown of the milk. Then the more recent development is the pregnancy-associated glycoproteins, and which have accuracy from 29 to 30 days post-breeding and persist for the entire pregnancy and up to 100 days postpartum. The disadvantage is that they persist for up to 100 days postpartum. This is the disadvantage. Then there are the tests like early pregnancy factor, which can be detected in serum of all mammals within 24 to 48 hours of fertilization and disappear within 24 to 48 hours after death or removal of the fetus. Then there is the relaxin assay, uh, which is applicable for dogs, foxes, and these species. They secrete the relaxin, and so from 20 to 30 days of gestation. So there are some commercially available kits which one can use for pregnancy diagnosis. Then vaginal biopsy has been suggested for pigs for pregnancy diagnosis. Then this vaginal cytology, the number of layers is high at estrus due to the influence of estrogen hormone, and decrease in the layers of vaginal epithelial cells at 18 to 25 days of gestation. Right. So I think we have discussed all the methods, and if you have any question, any query, you can right now ask me. Even if you don't ask me right now, you can send your query to my email gnpobs at the rate gmail.com. You can find me at YouTube. You can find me at the Instagram, GNP Sir Classes Instagram channel, or you can find me at the rate PurohitGN at Instagram. You can also find me at my Telegram and WhatsApp channels. Kindly download the GNP Sir Classes app. Kindly ask your friends to download the GNP Sir Classes app. Kindly join our courses. If you don't join our courses, kindly ask your colleagues to join our WhatsApp channels, WhatsApp groups, wherein we are providing the daily reading material for all the subjects. So hope to see you again, and in our next class we will be discussing another topic. Till then, have a nice time, and if you have any questions, you are welcome. If there are no questions, I will see you again in our next class. Till then, see you. Bye bye.